Hello my hospice family, welcome back to Duns Hospice. Okay, this video is a follow-up video to my previous one regarding hospice and conflict of interest. Okay, I just wanted to go a little bit more in depth with this video, okay, in regards to the topic. So in the last video I mentioned that sometimes even though the patient has a DNR, DNH, okay, do not hospitalize, the facility will still send them out to the ER, to the emergency room, you know, if any little thing happens, you know, they'll just kind of like panic and just send them straight to the emergency room, disregarding the fact that they have a DNH, or that the caregiver says for them to call hospice first, for them to call the hospice staff first before sending mom to the hospital. Okay, now that being said, so besides it being so disruptive, okay, to the patient's wishes, okay, at the end of life, okay, besides the fact that, you know, the patient now, you know, is at a hospital, is in a cold emergency room, okay, a hospice patient, by the way, okay, and if you guys see my previous videos, hospice means comfort measures. Hospice care means that the doctors say you have 6 months or less to live, okay, there's no more aggressive treatments, okay, right now focus on quality of life versus quantity, okay, and be comfortable. So imagine somebody like that, okay, your frail mom or dad, okay, on hospice care now is in a cold, loud emergency room, okay, and of course when he or she gets there, the doctors are going to be doing IV, they're going to be doing blood work, they're going to be doing imaging, you know, all the lights, you know, so the person is definitely not going to be comfortable. All right, so that defeats the purpose of, you know, hospice. But get this, all right, Medicare, the insurance companies, okay, who both pays for hospice and the hospitalization, they will not pay for both. They'll only choose one, okay? So when mom or dad goes to the ER, all right, automatically, unless they signed a revocation form, automatically the hospice is not getting paid, the hospital is getting paid. But get this, it gets even worse. The Medicare will in turn make us pay for the hospital stay. Yes, for the ER visit that we definitely did not authorize for mom to go into, because mom or dad is under our care. Okay, so Medicare will say, well, we signed the patient off to you. Okay, you are supposed to make them comfortable at home, make them comfortable in the nursing home, make them comfortable in the assisted living. So obviously you're not doing your job as hospice. So why is a person in the ER? So we're not paying for it. Okay, so now the hospice office, okay, the hospice management, the hospice, you know, company has to pay for the ER visit that we did not even most likely know about, definitely did not authorize, okay? It goes against the patient wishes, it goes against the family wishes, okay? All because the facility staff panics or just completely disregard the MOLS form, like I was saying, the DNH form, which is a legal document. They disregard the legal document, they disregard the family wishes, they disregard the patient wishes, they disregard what hospice has been teaching and educating them, and they sent mom to the hospital, and now hospice has to pay for the hospital bill because Medicare says, the health insurance says, no, you were supposed to be, we entrusted you with that patient, and now why is that patient in this cold emergency room? So therefore we are not getting involved. So my hospice family, do you follow? Do you follow? So this is a huge conflict of interest. So my hospice family, this is a huge conflict of interest, okay, that goes on in the hospice world. Okay, so let me know your thoughts. Let me know, you as a caregiver, have you had, or as a hospice staff, or even as a facility nurse, you know, maybe you did not know, so now watching this video, you know. Okay, so the more knowledge we are, the better choices we can make, the more resources we have available to us. Okay, so just share your thoughts. Let me know, you know, how you feel about this conflict of interest when it comes to hospice patients being sent to the emergency room when they have a do not hospitalized, okay, form. Unless say mom broke her hips, you know, is bleeding, of course we'll send them to the ER. And of course, if it's something that's major, we absolutely will, you know, send mom or dad to the hospital, the hospice patient to the hospital. That's absolutely a giving, okay? But for something minor, like, you know, say they have a fall or they're extra anxious today, you know, we don't want to do that because it defeats the purpose of making the patient comfortable. Okay, so yeah, so that's what I wanted to share with you, my hospice family. Let me know your thoughts. Let me know if you've had some similar experiences, and also if you are a facility nurse, now you know, please call the hospice office first. Call us first before deciding to send, you know, the hospice patient to the hospital. Okay, we just gotta work as a team. All right, follow me, subscribe. Let's help me to keep this channel going, to grow this channel, so that more and more people in the world can know about hospice. Okay, because you are not alone. We are here to help your loved ones at end of life to be comfortable. Okay, all right, see you in the next video. Take care.